You can now get your new COVID booster at some local health departments. Starting today, those new boosters became available in these counties you see behind me, highlighted green: Johnston, Cumberland, Orange, and Durham.
Wake County had to delay its launch until tomorrow after a hiccup in getting the doses. WRAL's Durham reporter Sarah Kruger is live from the Durham Health Department, where they are seeing a lot of demand there. Sarah.
Deborah, I talked to the health director today, and he told me there was a lot of interest today. While I was here at the health department, I decided to go on in and get the booster for myself. And then I saw that for myself. There was a line out the door of the vaccine room. I spoke with some experts today about why they say you should join that line and get your shot.
For many people, COVID fatigue is setting in, or did set in long ago. This newest booster, though, is worth paying attention to.
This is the first innovation that we've seen in the vaccine since it first came out. So we've been playing catch up with the virus, and now this really does present an opportunity where we've caught up.
Dr. David Wall with UNC explains the new booster is specifically designed to protect us from the most prevalent variant circulating right now. Boosters are available for those 12 and up.
2 months is a good rule of thumb. 2 months after your last shot, 2 months after you were diagnosed with COVID-19, that makes sense to me.
At the Durham Health Department, the first day of administering the new shot is going great.
Overwhelmingly positive. We're fortunate to be in a community here in Durham to where people know the value of vaccinations and they believe in the science.
Health Director Rod Jenkins says he has about 2,500 doses from the state, a mix of Pfizer and Moderna.
In my opinion, I can never have enough, but I think for the first several weeks, we have enough to take care of the demand, and I'm not afraid to make a little bit of noise to let them know that Durham needs more.
And that may be the case soon as people in Durham flock to get their shots.
I'm not so much worried about surviving, but the long COVID is what really worries me.
Everyone just do their part. The more they do it, the more effect it'll have.
A common question that I have heard is, can you get your booster at the same time as your flu shot? I asked Dr. Wall. He said there is no problem with that. Now, we know that some people are hesitant to go get their booster because they're worried about some side effects like feeling feverish or achy. Dr. Wall says do not let that deter you. He says it is totally fine to take some Tylenol after your shot, and in fact, that is what he did as well. Deborah.